Good morning, I'm Sunetra Choudhury, National Political Editor of Hindustan Times, bringing you the best stories from HT on Friday, April 17th. First up, a look at the numbers as they stand. There are now 13,397 people infected across the country. The number of people that have died are 447. But our top story, and perhaps it's a good news story, is that the head of the task force looking into COVID management, Dr. Vinod Paul, has told us that they are now finally seeing a flattening of the curve. That's right, they're saying that since March 13, when the infection was doubling every 3.5 days, that's Italian levels. That's how quickly it was being done in those countries that are affected really badly. Since then till now, they're saying at the moment the infection is only doubling 7 or 7.5 days, and they say that we haven't even seen the full impact of the lockdown just yet. Dr. Vinod Paul told Hindustan Times that during the lockdown and after a few days, we may see this infection rate increase to 10 days. That means it will take much longer for the numbers to double. So perhaps that is a good news. Of course, he's saying we've got all contingencies covered, but for now, it's looking good. Our second story is just an analysis of what the hotspot means. That means on Monday, when April 20th, when the second phase comes in and restrictions are supposed to ease for those places which are not impacted, how many of us are going to be impacted? Well, we've had a look at the numbers, and it seems that not many of us. If you look at it, then 453 million out of the nation of 1.2 billion people are still going to be living in hotspots. That means that 170 districts where 37% of India's population stays are all in the hotspots. And just to give an instance, in Delhi, out of the 11 districts, 10 are hotspots. In Maharashtra, 14 of the total districts are the hotspots. Of course, not all the district is going to be a hotspot, but still quite a significant number of people there impacted and won't get the relief that April 20th easing of the restrictions will bring. The next story that we have for you is perhaps just a sign of our times and just how desperate a lot of the migrant laborers are at the sign of an extended lockdown. We've already reported how they feel they may not have enough food. They're worried about where they're going to get their next wage from. And so the Gurgaon police has busted this racket where they found 2 ambulances carrying 10 people. There were 5 of them each. When they investigated further, they found that it was a racket where each of the migrants, they were people who were originally from Bihar, and they'd been promised that they'd be ferried all the way from Gurgaon to Bihar and they'd paid an advance of 9,000 rupees each. And the Gurgaon police has now arrested a hospital official who had managed to get those ambulances to ferry all of these people. So really tragic there, just how desperate people are to go back home at the thought of an extended lockdown. The next story that we have for you is a study that's come in from China, which says that patients may infect people 2 to 3 days before they start showing symptoms. This study is really important because at the moment we're only testing people who are symptomatic, which is they are either coughing, they have high fever, and they have problems with breathing. But this study says that 44% of people are actually infected by people who show no symptoms at all. It makes a case for India to increase the scope of testing and not just test those who are showing symptoms. And it also tells us that when you're tracing contacts, you have to really go back 2 to 3 days before the infected person started showing symptoms. Of course, the good news is that the symptoms and the rate of infection goes down significantly after 8 days when they first appear. And finally, can you imagine if you could make out if someone has COVID-19 by the sound of their voice or their cough? Well, that's what researchers in the University of Cambridge and the Carnegie Mellon University believe, and that's why they're developing these AI tools. At the moment, they are feeding a lot of the recordings of voice and cough, and along with information whether the person has COVID-19 or not, to AI tools. And this is based on the science that any change to the respiratory system will reflect in the voice. So really cool research then, something that we have to watch out for. That's all the news for now. You can keep tracking all of these stories on hindustantimes.com.